Good morning. Hello, everybody. Hello. Thank you, everybody, for joining us today, live on camera, through Zoom, or through your phone. I am so excited that we have this option available to be able to reach out and just interact with all of you. And thank you so much for taking time out of your day to be here with us. My name is Rebecca Kozak, and you are here with Ask Doc Live, a program that is being brought to you as a community resource from AskDocLive.com and the Critical Health News team. We are excited to be able to offer you this opportunity to ask the doctor himself questions in regards to what he would recommend based on his own research that would benefit the body, and really look at the not just look at the root cause and not just treat symptoms, but actually get to the root cause of why things are going on in the body. So for all of you that are here, if you were invited by somebody specific, please make sure that you get back with them if you have any questions in regards to any of the products that are mentioned here on this program. On behalf of myself, Rebecca Kozak, my co-host, John T. McCollier, Ruth Ellen Sanchez, and Nasima Omar, we want to make sure that you are getting the information that you need, and you're getting it from a source that is going to make sure that you are getting fresh product, genuine product to meet your nutritional needs. So get back with that person that invited you to watch this show, whether you're here live or on the replay. Now, for those of you who are on with us live, I do want to make sure that you know that there is a chat function that is available in the Zoom menu. Go ahead and hit that chat. You'll be able to see all of the information that Nasima and Ruth Ellen and Jonty are putting up in the chat to help you with what products Dr. Wallach is recommending and where you can go to get additional information if you don't have somebody to talk to already. Now, we do want to make sure that you know that there is no solicitation in this chat of any kind. And if you do have any type of solicitation, you will be removed from the Zoom. Hate to do that, but this is a resource. We want to make sure that it's completely just neutral when it comes to that. The content of this program is to provide educational information only on the importance of nutrition and supplementation in a world where the food supply is empty and void of what the body really needs, not just to survive, but actually to thrive. In this program, we will be sharing nutritional options that are available through supplementation in a form that the body can readily absorb and utilize. But the FDA does require us to let you know that our products are not meant to treat, prevent, diagnose, or cure any diseases, and this program is not meant to take the place of your primary care physician. We do bring good news, especially in a time where everything seems to be not so good when it comes to health. The genetic theory has been proven incorrect through the science of epigenetics. Epigenetics is the study of how your behaviors and environment can cause changes that affect the way your genes work. So you are an empowered individual when it comes to the way your body is going to function, no matter what your family history has been in most cases. With epigenetics, you do have control over this health journey, and we invite you to feel the difference with the options that are going to be shared in this program. To guide us through this, we are so honored to have one of the founding fathers of the study of epigenetics here to share the best options to obtain and maintain optimal health. Now, any testimonials that are shared on this program are the testimonials of the individual themselves. They are not paid. We do not ask them to come on. But I love hearing other people getting that real benefit from giving the body what it needs so it can do what it's designed to do. Now, without further ado, it is my honor and privilege to introduce and welcome Dr. Joel Wallach. Welcome, Dr. Wallach.
Thank you, Rebecca, and thank you to the entire team this morning. Thank you, ladies and gentlemen. And of course, there's always news. And so I'm going to start out with the fact that we're still in trouble with the COVID. After 18 months, we're still in trouble with it. It's spiking again. In the last 28 days, this just came out, last 28 days, we've had 3.7 million new infections in the United States and 52,000 dead. That's just in the last 28 days. This morning, the news was released that U.S. Supreme Court Justice Brett Kavanaugh tested positive for COVID. He was fully vaccinated, and this is a breakthrough infection. His wife and daughters are also fully vaccinated, and they tested negative. And this is not unusual. We have thousands and thousands and thousands of breakthrough cases where people have had 2 vaccinations, and then 3 months later, 6 months later, they're tested positive for COVID. Well, how can that be? And of course, there is a significant death rate in people who've been vaccinated who die of COVID. What's going on here? Well, you have to appreciate that vaccines do not kill the bugs. Vaccines do not kill the viruses. And a lot of people, they have this misbelief that the vaccinations actually kill the virus. No, they don't. They just alert your body to bad DNA and RNA, which is in the virus. So when the virus shows up, everybody says, oh, there's the bad guy, because I recognize that bad DNA and RNA. And then it's up to you to deal with it, to respond. Well, there's 2 things you need to do to be able to fruitfully expand and do the right thing. Number 1, you need to be able to absorb nutrients. So if you're eating gluten, you got to get rid of gluten. No wheat, no barley, rye, and oats, no fried foods, no processed meats, no oils, no glutens, no wheat, barley, rye, and oats, no sugar, no carbonated drinks. All that stuff's got to go to maximize absorption. There are no such things as gluten-free oats. There are no such things as good wheat. Well, I have oatmeal for breakfast every morning. I take a oat rub, at my massage therapist, they use this oatmeal on me. Well, that's why you're sick. Okay, because you can't absorb nutrients. And then you need to supplement with the 90. And because we have the pandemic going on right now, we use the heavier hammer in our toolbox, which is the Healthy Brain and Heart Pack. It has 215 nutrients in it, the core of which, of course, is the 90 essential nutrients, the Healthy Start Pack. Well, I eat well. Well, that's like saying I put dirt from Texas and Oklahoma in my car, so I don't need to put oil in there. There's bound to be some oil in that dirt from Texas and Oklahoma because that's where a lot of oil wells are. So it's bound to be, I don't need to put oil in there. I just use dirt from Texas and Oklahoma. Well, an insane person would not do that to their car. So when you talk about, oh, I just eat well, so I don't need to get vaccinated, I don't need to supplement, you need to go to a psychiatric ward, okay, because you're not thinking properly. All right, this is bad stuff. Well, this morning's figures, which include all these new numbers that I passed on to you, as of this morning, we had, and I'm on the West Coast here, 44,315,162 infections and 716,849 dead. You have to appreciate that during the Spanish flu, 1918, 1919, which was 2 years, we had 675,000 dead. We're only 18 months into this COVID-19 pandemic. And this morning we had 716,849 dead as opposed to 675 in the Spanish flu. And so we're looking at let's see here, we're looking at an increase of 41,141, okay, over the Spanish flu numbers. Increase of 41,000, and we're still only at 18 months. We're at the first day of the 19th month of the COVID-19 thing. And so this is a full-time job. You have kids, they need to be, right now they're gonna make the vaccines available. And so it's everybody's choice whether you're gonna vaccinate them or not. But I have to tell you another statistic, right now, the hospitals are so overwhelmed with patients, they're having to rent trailers to put patients in. 93% of the people in the hospitals are unvaccinated, and 35% are kids under the age of 10 in the hospital now. And so this is very scary stuff. And so we really, really have to pay attention. We have our hand sanitizer, of course. I go through a lot of that. I go through a lot of that. So I know I got some somewhere. Oh yeah, here we go. I use this hand sanitizer. I go through about, I don't know, 6 of these little 2-ounce bottles every month. Use that on my hands and my neck and my arms and my legs and my feet and in between my toes 3 or 4 times a day. And we have the colloidal silver. I take 2 droppers full of this under my tongue 30 minutes for each meal and 30 minutes for bedtime. It kills everything, viruses, bacteria, fungus, and yeast. It tastes like water. There's no negative taste to it, so you can't complain about the taste. And I do that as well as I've been taking the 90 essential nutrients for 74 years. I've been taking the 215 nutrients in the Healthy Brain and Heart Pack for probably the last 6 years. All right. And which contains the 90. So I'm getting an additional 115 nutrients. And then I've been gluten-free for 74 years. And so this is something you're going to have to work at. You just can't say, well, I eat well. I hear that all the time. Well, if you want to add 25 to 50 healthful years to your life and spend more time with the people you love and spend more time doing the things you love to do, then you got to do this. I mean, you can't just run around and do all the bad stuff. Well, I got good genes. My family, they all lived to be in their 70s. Well, that's not very good when the human life expectancy is 155. And so this is something that you have to have family meetings on. You cannot, I have people who have very obvious gluten problems. I say, I do not eat gluten. Well, do you cook for other people? Well, yeah, I cook for everybody in the house. Well, do you cook gluten for them? Well, yeah, they won't give up their oatmeal for breakfast. Well, that's why you're sick, because you're still getting cross-contaminated by the dust from the oatmeal and the pancake, flour and the flour tortillas and the spaghetti and chicken noodle soup and all that kind of stuff. And you're rolling the fish in flour before you fry it. And you're frying it, which is bad, and you're rolling it in flour, which is wheat. And so that's why you have a gluten issue, because you're cross-contaminating yourself. So you have to be much, 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 much more careful than you are doing. Now, there's other pieces. There's all these pre-existing conditions. Remember, as Rebecca very supremely said, that there are no genetic diseases. You do have to say, well, my whole family has always had these diseases, so I'm going to get it because they're genetic. No, they're not genetic, because you're eating the same way. That's why you're going to get their problems. So you have to change everything if you don't want to have those problems. You want to add 25 to 50 healthy years to your life. Obesity is one of the biggest pre-existing conditions that get you in trouble. And you might be on 3, 5, 8, 10, 12, 15, 20, 30 different prescriptions for high blood pressure, diabetes, obesity, pain in your back because you got sciatica, thyroid issues, all this kind of stuff. But I said this before, but it's worth repeating. I was saying, we have so many people. I'm seeing so many people now, Rebecca, who are 500 pounds. I mean, I used to see a lot of people who were 300, 400 pounds, but now I'm starting to see a lot more people who are 500 pounds. And so I asked Siri, I said, Siri, what is the documented, unimpeachable record for the heaviest human in America? For males, is 1,400 pounds. Each leg weighed 400 pounds. For women, is 1,200 pounds. Now, being overweight and obese is something you don't need to go to a doctor to get diagnosed for. You get on a scale. If you're 25 pounds over your ideal weight for your height, you're obese. And so that's why we have the keto caramel meals. You can start out with one of those a day. It doesn't have to be the same meal every day, but 7 days a week, one meal, a keto meal. And then the other 2 meals you want to eat like an Asian. Just eat like an Asian. We're talking about rice and sweet potatoes and beans and squash and vegetables. And you can have fish, you can have red meat, but absolutely no wheat, bread, rye, and oats. When you look at India, they have a big problem, and 95% of their deaths occur in the northern 9 states, and only 5% occur in the southern 20 states and 7 territories. 87% of their infections in India occur in the 9 northern states, and only 13% occur in the southern 20 states and the 7 territories. So why is there such a difference there? Well, it's diet And the fact that the British occupied northern India for 100 years and taught all the people in northern India how to grow wheat, bran, rye, and oats, and how to eat wheat, bran, rye, and oats, and how to drink wheat, bran, rye, and oats. And so they've been eating and drinking gluten for over 100 years because of the British, and that's why they're getting hit hard. And they're a homogenous people, okay? Nasima can tell you, the people in India, they're a homogenous people. They don't have 18 different races in it like we have here in the United States, okay? They're very homogenous people. But they eat differently in the north, where they're occupied by the British for 100 years, than they do in the south, where they eat more like Asians, where they eat a lot of corn and rice and beans and vegetables and that kind of stuff, a lot of fish and so on. So this is unimpeachable evidence. And so we also have the killer biotic, which is a reishi mushroom, and I think it's like 6 other mushrooms in there, supports your immune system. We have the Ultimate Daily Classic, tablets for high blood pressure. We have the sweeties for diabetes. We have Ocean's Gold for thyroid, and we have the Fucoid Z capsules and the Z radical, the same formula. One's Z radical is a liquid, and Fucoid Z is a powder from algae. So you get all this weird stuff from the algae. And these things will add 25 to 50 healthy years of your life if you get gluten-free, because your body needs them. Every cell, every tissue, every organ in your body needs them to maintain themselves, repair themselves, replace themselves when they die, because none of your cells in your body or tissues or organs are built to last forever. They're designed to maintain and repair themselves, but it requires all this stuff. And one of the greatest, what should I say, one of the greatest byproducts, okay, to help people occurred after all the dinosaurs died out. You know, we had thousands of species die out in the big mass extinctions. We're talking 500 million years ago. And then 100 million years later, the dinosaurs died out. And now we have all these dead zones. I think the first one was seen on the East Coast, like in 1910. But they had dead zones 500 million years ago. Okay, so one of the best side benefits of what we do now has to do with agriculture. The people in India, of course, they have the history, okay, of things. I'm not going to get to it right now, but let's go to Egypt. They were one of the most successful communities in humanity. And then, of course, in addition to the Egyptians, and then you had the Hebrews, you had the Christians, and so forth, they're all in Egypt. And that's because of the Nile River. They were irrigating with the Nile River. They actually were the first country thousands of years ago to put wheat in boats and take it to other countries and places and sell it and trade in other places. Their wheat they grew because they had all this extra grain. Well, in their museum, they have stuff from the days of the pharaohs thousands of years ago when they were building the pyramids. One of the things they have is a big jar full of the silt from the river, from the Nile River back thousands of years ago. It has 27 minerals in it, 27, including the 21 that are required for photosynthesis. So one of the best things that came to us through agriculture was oxygen. The reason why all those species died out during the mass extinction was hypoxia. Okay, and that's because of glaciers forming dams, moraines, blocking off the food supply to the algae, no oxygen. They require 20 nutrients to do photosynthesis. My new CD is out now. We had one person buy 100 copies yesterday. Okay, this new CD, is okay. The new CD is Dr. Wallach's Laws of Photosynthetic Disruption and Global Warming, because it's the lack of oxygen that's causing us to have our problems. Well, there's oxygen everywhere. No, there's not. Think of that little family that died in the Yosemite National Park. A mom, a dad, an 8-year-old kid, and the dog. They were walking through this path and nobody else around them. They couldn't find them for a week, and they went up there and they found them. And they were dead and they couldn't find any drugs in them. They couldn't find any bullet holes in them. They're scratching their head. Well, they died of hypoxia. They didn't have enough oxygen because that was a little dead zone. You have dead zones in your house. And that's why we want you to have, in addition to all your 90 essential nutrients, take our Oxy Body twice a day. Get you some oxygen. For the little kids, give them some Oxy Body. You also want to have in addition to the Oxy Body, you want to make sure that you're getting potted house plants around every window inside your house, your bedrooms, your bathrooms, your kitchen, the kids' playrooms, every place there's a window. You want 1 or 2 potted plants, and you want to put 2 ounces of our plant-derived colloidal minerals in a pint of water and water them twice a week. And that'll prevent you from saying, I'm not going to have any more potted plants because I don't have a green thumb. Every time I put a plant in the house, it dies in a month. Well, that's because you're just watering it. You need to give it those 20 nutrients they need for photosynthesis, and just watering a plant with tap water, not going to cut it. That's why your plants die. It's not you don't have a green thumb. You're not giving it the nutrients it needs to perform photosynthesis. So this CD goes into all this, and it'll blow your mind, all the stuff we know, and all the things we're not doing, we should be doing. But agriculture produces not only food for us, but it also provides oxygen. All of the 12 pre-humans, the hominids, that were humans, but not quite humans, not Homo sapiens yet. Every one of them died from lack of oxygen during the mass extinctions and mass die-offs and dead zones and everything. They died from lack of oxygen because they were hunters and gatherers. Now, Egypt started something different. They started mass agriculture. And all the plants that they grew put off oxygen, and they were fertilizing it with, manure and stuff like that. And the bodies of their slaves that they killed and so forth, fertilizing with everything. But because they had these plants for food, the gardens and were actually in the farms were giving off all this oxygen. And that's why there were so many beautiful things that happened with the Egyptians and the Hebrews and the Christians in that area, because of all the oxygen coming out of the fields and the crops. Whereas the hunter-gatherers, they'd go into a dead zone like that couple up in Yosemite National Park, and they would die. No oxygen. So this is coming out. I'm probably about 25% done with collecting all the data for the book. And so the book will be coming out probably by the end of this year. I'm very excited about that. And it's just unimpeachable evidence that I know exactly why we had the mass die-offs and mass extinctions of thousands of species, dinosaurs. We have the mass extinctions now. We have the dead zones, why we have trouble with the reefs. We've shut off the food supply to the algae, which produce the oxygen, which the coral polyps need to make reefs. Mm-hmm. And so it's all these systems. And once you track it all, and that's where my experience as a pathologist, 32,000 autopsies, that's where my experience as a pathologist. I asked the question, then I asked the next question, I asked the next question. So I know what questions to ask. And over time, I've learned who and where to go to find the answers. Well, thank goodness for Siri.
You can ask Siri almost any question and she'll give you an answer, right or wrong. That's right.
It's just amazing. Okay. All right. Now, I'll remind everybody, in addition to obesity is one of these pre-existing conditions that gets you in trouble with COVID. It tells you you got a deficiency, because what made you obese was a deficiency which gave you a behavior called pica, and you just eat and eat and eat and eat and eat.
I think we might have lost Dr. Wallach. He will be right back. But during this time, while we're waiting for him to come back, I just want to thank everybody for being on with us with Ask Doc Live, where we are bringing nutritional information to you, and information that you're not going to hear anywhere else, especially on mainstream news. This is information that is coming, like Dr. Wallach said, through his many autopsies, his many years of doing actual work as a pathologist and looking at just so many different aspects of life that most don't look at. So I am super excited that Dr. Wallach is here and sharing this information with us, because I don't know anywhere else that we would get this information, Dr. Wallach.
Okay, well, I apologize for, there's somebody who was trying to call me and I touched the button.
No worries.
And so I apologize. And so at any rate, I had to get rid of him. But at any rate, so it's one of those things where it's just very obvious what's going on here. And so it's in our hands to solve these problems. We know the answer. We know the answer. And so we get rid of the bad stuff, do all the good stuff, and nobody's going to die of COVID. You might get kind of like a flu-like symptoms, but you're not going to die from it. But if you don't take care of yourself, if you're not taking the 90 essential nutrients and you are eating gluten, you're going to have a bad outcome. Another very bad thing is diabetes. All right. Well, diabetes is a very simple nutritional deficiency. It's not genetic. I don't care if you've had it for 40 years. We can get rid of it and give me 90 days. You won't be a diabetic anymore. And then same way with arthritis. Oh, my doctor says it's genetic. I had it in 5 generations of my family. No. He wants to give me a knee replacement. No. Give me 90 days, and you make your decision after 90 days on my program if you really want to have the surgery or not. Don't just, when you're in pain, say, oh, whatever you say, doctor. Don't do that, because he has kids in college and he needs the tuition money. That's why he wants to give you a knee replacement. Okay. And then same thing, one of the first things that people knew back in the old days, again, were the Egyptians. They would take and they would dry algae from the ocean and seaweed and stuff like that. When people had goiter, they would give them the algae and the seaweed, and within a couple of weeks, their goiter would go away. Because when you have goiter, you're missing iodine. And of course, there's a lot of iodine in the seaweed from the ocean. And so that's why they did that. And so these are the sort of things they would learn and do, and it's in their writings and so forth. So there's nothing new under the sun when you really look at it. We know the answers to these things, but usually if you really get far off the path, it's usually for a financial reason. And so health insurance was one of the worst things for human health, because it gave doctors the excuse to put you on 5, 10, 15, 20, 30 different prescriptions, and you didn't feel bad about it because insurance paid. So, well, I'm not really hurting the patients financially because insurance is paying for it. Yes, but you're not curing them. And then I learned that one of the first things they teach a medical student is that when you cure a patient, you lose a customer. That's one of the first things they teach medical students. When you cure a patient, you lose a customer. Do not cure your patients. You manage their disease.
Well, I'm going to manage good health, Dr. Wallach. That's what I want to manage.
Okay.
And coming from, almost 270 pounds, I can't imagine being heavier.
Wow.
But and my heart aches for those that have struggled with weight. But from my personal experience, adding the minerals and the 90 essential nutrients, not only did I start feeling better, the weight started coming off. I had more energy to do the things that I needed to do to really work on toning the body. But the simplest part about it was taking nutrients, taking supplements.
Yeah, well, how much you weigh now?
I'm at 100 and I don't want to say because I still have 20 more pounds. So I'm at 168 pounds right now.
Well, you wear it well. You look like you weigh about 120.
Oh, well, thank you. I love the camera some days. So yeah, I mean, it's, and I love the fact that, it's not overnight. If it was easy, it wouldn't be worth doing.
Yeah, no, it's a process, because you have to give your body what it needs. You get rid of that behavior, that pica, P-I-C-A, you can look it up in any dictionary. And yeah, obesity is easy to deal with. High blood pressure is easy to deal with. Diabetes is easy to deal with. We take people who haven't urinated in 10 years or on dialysis 6 days a week, and in 2 weeks' time with our program, they're down to 3 dialysis a week and they're urinating after 10 years of not urinating. And then in 2 more weeks, they're totally off of dialysis. They're back to normal life without dialysis. And so we've been doing this for over 30 years. We have a long experience. And I guess it's close to 50 years now that I've been doing this. And personally, I've been doing these things for 74 years. So there we are.
Well, and you've come up against a lot of resistance. And I love the fact that you did not let that resistance stop you, Dr. Wallach. Our bodies are not chemical deficient.
Yeah.
It all comes down to nutrients. And there's some things that the body naturally creates, but for the most part, Dr. Wallach, our food is empty. And if we're not getting the nutrients from our food, we've got to get them from somewhere else.
Yeah, well, you're not getting them from your foods because things have changed. We have electricity. We don't have wood stoves anymore. Wood ashes were minerals, which we put in our gardens and put in our food. 1882, and Thomas Edison pulled that switch. That was the beginning of our big troubles. Okay. Farmers used to be the healthiest people in the world. Again, they got oxygen. They got, all the fresh vegetables and meat and milk and cheese and so forth. But when we went to electricity, all those wood ashes that were going into the gardens and our food went away. Now, you've heard of sequoia trees, right?
Oh, yeah.
I mean, what do they weigh? 50 tons? I mean, they're huge. Now, all the wood in that sequoia tree came from carbon dioxide in the air from photosynthesis. The green leaves, okay, and the top of that little twig, 5 or 6 inches high, began to take, release the oxygen into the atmosphere and then put the carbon into making the trunk of that tree and the branches of that tree. And over a period of 100 years, that tree now, weighs what, 5 tons or something, or more than that, maybe. Okay, it's huge because all that wood came from the carbon that those green chloroplasts were taking the carbon chains out of the air and turning them into the wood in the sequoia tree. People don't think about that. Where does the wood come from in trees? It comes from the carbon dioxide in the air. But they have to have the nutrients, okay, to be able to do photosynthesis. And that's why this CD is going so well right now. Dr. Wallach's law of photosynthetic disruption and global warming. Global warming is not the answer. There were no cars 500 million years ago when they had the mass extinctions. There is no cars and fossil fuels 400 million years ago when the dinosaurs died out. Okay, there's none of those things. Okay, it doesn't compute. So I knew there had to be another answer. And so when you start looking, it just pops out at you why did these people die? These 12 sort of pre-humans, why did they die? Well, they all died of hypoxia because of dead zones. We only discovered dead zones in 1910. That doesn't mean there weren't dead zones before that. We just were ignorant and didn't know about them until then.
Right. Well, there's a lot of things, Dr. Wallach, that you have discovered, and I love the fact that you're not afraid to bring them to the light and allow us to be able to help you do that. Thank you so much.
Well, we make a good team. And let's see
do.
here. Okay, well, it's do you want to take it or do you want me to take a few more minutes? What do you want me to do?
Well, I wanted to make sure that everybody knows that if they have a question for you, please use the reactions in the Zoom menu and you will find the place where you can raise your hand there. I do have lots of questions, Dr. Wallach, that have come in through email. We have some hands up. We have some questions that have been put into the chat. If you have something else that you would like to share, then absolutely, Dr. Wallach.
Okay, let's just do one more quick thing. When you look at in the United States, who are the peoples who are having the worst time with COVID? It's the Hispanics, the Blacks, and the indigenous peoples. Now, this is not a racial thing, it's a dietary thing. When you look at the top 3 states that have the worst record, we have the most infections, the most deaths, California, Texas, and Florida. And now Georgia's coming up with number 4. Let's see here, California has 39% Hispanic, 8% Black, and about 10% indigenous peoples. Texas has 39% Hispanic, 14% Black, and about 10% indigenous people. Let's see here, Georgia has 9.5% Latinos, but 34% Black. They have the highest population of Black people, and they have about the 4th or 5th largest number of deaths every day in the country, in Georgia. Number 1 is usually Texas. They're averaging 300 to 400 dead every day from the COVID. It's like crazy. Just that one state, 300 to 400 dead every day. That's not a month, that's per day. So it's like 3,000 a month. Okay. It's one of those crazy, crazy, crazy things. And I have to tell you that this is all easily dealt with, but people have to change their diet and live like an Asian. I've been saying this forever, because Asians, there's exceptions. There's Asians who live around the military bases, and they're cooking food for the military people to come to their restaurants, and they eat those foods and so forth. So the people who are eating, as I said earlier, like the British, like the Americans, like the Spanish, like the Italians, and eating wheat, barley, rye, and oats, the Asians have a rough time. Now, when you look at the Asians who eat like Asians, they're not having the bad time like we have. And of course, they have longer lives than we have. I'm trying to find my paper here. It's one of those things where, let's just look at something like Arizona and Hong Kong. Now, these numbers are not new, but they're still relative because they show you, this goes back about a couple of weeks ago. Hong Kong had 212 dead, and Arizona had 18,000 dead.
So when you say eat like an Asian, we're not talking about an Americanized Asian diet. We're talking about unprocessed, simple ingredients that give nutrition and allow the body to do what it's able to do without interfering.
Yeah, you need to eat rice instead of oats. You need to eat beans, okay, instead of noodles. You need to eat sweet potatoes instead of fried potatoes. You need to eat gluten-free pizza crust. I eat gluten-free pizza maybe 2 nights a week and 1 or 2 breakfasts a week. And the crust is made from cauliflower and rice flour. But the kids and grandkids don't know that. They just know they're getting a fun pizza with 4 cheese and all those vegetables. We put hamburger patties on there. We'll put fish that have been packed in water, not oil, on top of the pizza. And so they get everything they want, but they're not getting any gluten. And so I say, how'd you like that pizza? It was wonderful. Well, it's gluten-free, and here's the box. So if you're going to go buy if you're going to go buy a pizza, you take the box and you say, it's got to be like this, okay? And that way you'll be gluten-free, and it makes all the difference in the world. Also, the Asians, they make their beer and their whiskey out of rice. There's no gluten in their beer and whiskey. Now you take the beer and whiskey from Europe and Canada, the United States, it's all made from wheat, barley, rye, and oats. Rye whiskey, I think there's maybe 1 or 2 beers made in the United States that are made with rice, but we get our beer from Australia and New Zealand. You can get it in any liquor store. It's made from rice. Okay, you don't want the wheat. And of course, we have a glass of wine every night with dinner. I've been doing that for 60 years. Okay, a glass of red wine every night. There's no gluten in grapes.
Right. All right. Well, everybody, I just want you to realize that, what you put in your mouth is going to determine your health tomorrow or the
and your
next
longevity
day,
and your longevity.
Your longevity. Absolutely. And I'm looking forward, Dr. Wallach. I mean, I used to just trying to get out of bed hurt. And I wasn't looking forward to having to get up and walk and do anything. And now I just love the fact that I can wake up in the morning, go all day long, no pain, no restrictions of any sort, and I'm loving life. I look forward to getting older because I feel like I'm aging backwards.
Now, are you
And
passing this information on to your kids?
oh, absolutely.
What do they think?
Absolutely. Well, so my oldest is like, Mom, this was my first winter, and I was out playing with the kids, and we were going up and down the hills, and I was pulling them on the sled, and he's like, Mom, you didn't play with us like this when we were kids. And I'm like, well, that's because I hurt so bad. He says, I know. He says, it's so fantastic that you're able to do it now with the grandkids. And the fact that he recognized that.
Isn't that a
just
beautiful
really
thing?
touched my heart.
Yep.
Yeah. I love it. I absolutely love it. I mean, I could take him to the playground. I can go up and down the stairs, down the slide. Because one, I'm not too big anymore. And the fact that I have the flexibility to be able to do it now. I think it's just absolutely fabulous. And
Well,
it's
you
all
are
because I
fabulous.
heard you on the radio, Dr. Wallach.
Okay.
So,
Well, thank you so much, you and your team.
well, thank you. Thank you. So let's go ahead and get to some questions.
Okay.
Again, if you're here listening to this program or watching the replay and you hear somebody describing some of the things that you've got going on, pay attention. Dr. Wall is going to tell you exactly what needs to be done in order to address any type of deficiencies that are causing the symptoms that are going on. And get with the person that shared this program with you. Now, if you weren't shared this program by anybody specific, you found it on your own, you can go to AskDocLive.com. We have a store there that has all of the products that Dr. Wallach is going to be mentioning. We also have Dr. Wallach's books there. You can find all of his most popular publications in our link on our store. And if you have questions not knowing exactly what you need to take, we have a contact us option there, and you can send us an email, and one of our certified holistic health coaches will get back with you in regards to what's going to be a best protocol for you to meet your needs. So Dr. Wallach, let's go to Joe. Joe is the first hand that is up. Joe, if you can go ahead and unmute yourself, and if you're able to turn your camera on, that would be absolutely fantastic. That allows Dr. Wallach more information to help you with what you have going on as well.
Yes, good morning. Good morning, Dr. Wallach.
Good morning.
Yes, my wife is 61 years old, 5'2", 120 pounds. She had a mastectomy on September, let's see, I think the 10th, and she's going to start chemotherapy today.
Okay. Now, did you say she was 220 pounds?
No, 120.
120. Okay.
Yeah.
And does she have any other issues? High blood pressure, diabetes?
A little bit of high blood pressure, yes.
Okay. She on medication?
Yes.
Okay. Does she have any skin problems, any eczema, dermatitis, or psoriasis?
No.
Does she have any bowel problems, constipation, diarrhea, irritable bowel syndrome, celiac disease, anything like that?
No.
Okay, good. Does she have any arthritis, any back problems, peripheral neuropathies?
Nope.
Okay, so her real challenge here, at 5'2", and she weighs 120 pounds, that's not bad. So she has been diagnosed with breast cancer. Is it stage 1, stage 2, or what's going on?
Okay. Originally, she was diagnosed with anyway. They took the breast out, and they found the HER2 plus in the pathology report. So they want to give her a 12-week chemo plus another year worth on of some other type of chemo,
Mhm,
1
mhm.
to 3 weeks.
Okay, okay. So anyway, so they're saying it's a malignancy, right?
They said possible.
Oh, okay. So anyway, here we go. Number one, what state do you live in, Joe?
California, San Jose.
Oh, okay. So you need to get rid of all the bad foods. You, your wife, the dog, the cat, the bird, the fish, everybody in the household, caregivers, people who come to clean the house, everybody's got to be drop dead, gluten-free. No wheat, barley, rye, or oats, no fried foods, no processed meats, no oils, no glutens, no wheat, barley, rye, and oats, no sugar, no carbonated drinks. And then at 120 pounds, I wanted to have one healthy brain and heart pack per month. Get another bottle of Arsenal, not from Walgreens, but Arsenal with the 5 cofactors. I wanted to take 3 twice a day. There's 1 bottle in the Healthy Brain and Heart Pack. So get another bottle, she'll be able to take 3 twice a day. I also want her to have 1 bottle a month of our MSM, so she can take 3 twice a day. And they will support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, including the walls of arteries and veins and skin and that kind of stuff. So she needs to be taking that, that's the MSM. I also want her to have the Fucoid Z capsules. She can take 3 of those twice a day. Fucoid Z 3 twice a day. That's 2 bottles a month. That's for her immune system. I also want her to have the killer biotic for the reishi mushrooms. That's for her immune system. Take 3 twice a day. And for the blood pressure, I want her to have the Ultimate Daily Classic tablets. Take 3 twice a day, 2 bottles a month. Don't cold turkey off the blood pressure medication, but as her blood pressure begins to get better, she can slowly reduce the amount of her medication. Might take, anywhere from a couple of weeks to 90 days. Usually within 90 days, they're totally off their medication by doing it that way. And then, keep us informed. Let us know, what all the final results of all the tests are and everything. And, whatever your decisions are and what's going on. So, call us in 2 weeks and 4 weeks and 6 weeks, and your testimony will help a lot of people. So we look forward to hearing from you.
Okay, Doc, you mentioned no oil. So
No oil,
does that mean that not even olive oil?
especially olive oil. Okay. If you want to pull an olive off a tree and eat an olive, that's fine. But you don't want to be using olive oil for salad dressing or cooking that's been extracted from an olive and then stored in a warehouse for 3 months at 120 degrees, and then in the store on the shelf at room temperature for a week or 2 or a month. And then you take it home and it's already oxidized and turned into bad stuff that causes cancer.
Okay.
Okay. And so oils that are extracted from the seeds can be bad. We have our EFAs and our EFA pluses, which are extracted in rooms and under very, very tight control, which has no oxygen. It's all nitrogen. And then we flush nitrogen through the soft gel capsules. We flush the bottles with nitrogen. And then we flush it after we put all the capsules in there. We're still in this room with no oxygen. Everybody's wearing scuba gear. And so there's no oxygen damage to the oil that comes out of the seeds and the fish that we make our EFAs and EFA pluses from. And then we seal it. And so this is our EFAs and EFA pluses are the only ones on the market that have minimal or no oxygen damage.
Okay. And what about calcium deficiencies?
Well, you're going to be covered there, but if she has, if she has back problems, if she's got osteoporosis, joint problems in her knees, I would add to the program I just gave you for her, our Cal Toddy. At 120 pounds, she could take a ½ ounce of breakfast, ½ ounce of dinner, so 1 quart will last her a month. And the Cal Toddy has not only liquid calcium, very easy to absorb, but it also has vitamin D3 and extra collagen in it. Okay.
Okay. Okay. Now, for myself, on Monday, I just had a thyroidectomy. So I no longer have any thyroids.
Well, why do they take your thyroid out?
They discovered cancer in there from Stanford and other places.
Well, you should have stayed away from Stanford.
Okay.
Okay. But at any rate, how much do you weigh?
185, 6 foot tall, 72 years old.
Mm-hmm. All right. So what I want you to do is, like your wife, I want you to get rid of all the bad foods. So you both need to be free of fried foods, processed meats, oils, and glutens, wheat, brown rice, oats, and sugar. No carbonated drinks. Even the diet one's got to go. And you need 2 healthy brain and heart packs per month, 2 per month, a full dose of everything twice a day. I want you to get also the MSM. I want you to get 2 bottles a month. So you can take 3 with breakfast, 3 with lunch, 3 with dinner. They'll support and promote maintenance, repair, cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone, makes your bone itself. I'm assuming they've given you medication to replace the thyroid. Okay, some
Yes.
thyroid pills.
Yes.
Okay, but I also want you to take our Ocean's Gold, take 3 of those twice a day. And then I also want you to take our Fucoid Z, take 3 of those twice a day. Now, people say, well, if the thyroid's gone, what do I need all that stuff for? Well, here's why. Because the cells that were receiving the messages from the thyroid hormone need those nutrients to be able to get the message from the thyroid hormone and do their job. If you don't have these nutrients, they can't respond properly. And so you need to take the Ocean's Gold, take 3 of those twice a day, it's 2 bottles a month. Take the Fucoid Z, 3 of those twice a day, it's 2 bottles a month. They come from 2 different oceans. And so you're getting all these weird trace minerals that the thyroid loves, and these cells that are responding to the thyroid hormones in your body require those nutrients to respond to the hormone. So you're doing something that the doctors don't pay attention to. Okay.
Okay.
Give us a call every couple of weeks.
All right, Doc.
Okay. Yeah. And when you go to the doctor and they do more tests, let us know what they say, because they're going to raise their eyebrows and scratch their head and say, what are you doing? Because you're going to be much, much, much better than they anticipate. Okay. Let's go back to Rebecca.
All right, Joe, you and your wife both are going to be in our thoughts. And get with the person that invited you to this program to get the supplementation that you need, also to help strengthen the body and allow the body to be able to fight off stuff that's going on. Now, Dr. Wallach, wife has cancer, husband has cancer. There's something missing in the diet.
Well, things are missing in the diet, and they were eating bad foods. I guarantee you they were eating fried foods. And he was asking about oil, but maybe they used olive oil. He had a little bit of an accent. So, where was he from? Using a lot of olive oil in his salads and olive oil in cooking. And you heat those oils up, they turn into trans fats, heterocyclamines, or acrylides, and cause cancer. And so that's, it's something in their environment and or their diet. Could be both. Could be the diet. Yeah. And oh no, it's not genetic. Well, I don't know how you get a genetic disease from your spouse.
Right. Or yeah, not coming from the same mom and dad. And anyways.
Yeah.
Well, thank you so much for that, Dr. Wallach. Let's go to Wanda before our break.
Okay.
Wanda, go ahead and unmute yourself.
Hello, Wanda.
I just sent a request. Did you see the request to unmute? Let's try that again. There we go.
Okay, I'm unmuted now.
Yes.
Okay, my question is, I've been diagnosed with bone-on-bone arthritis. And I guess that's really it. I just wanted to know your recommendations for that.
Sure. Okay, Wanda, how old are you?
75.
And how much do you weigh?
240.
And how tall are you?
5'2".
Okay, 5'2". I'd like to see you weigh 110. She needs to lose about 130 pounds. All right, so I want you to get off all the bad foods. No fried foods, no processed meats, no oils, no gluten, no wheat, brown rice, no sugar, no carbonated drinks. Do you have anything else, any high blood pressure that you're taking medication for, or diabetes you're taking medication for?
Yeah, both.
Okay, because people do that. So if you think you got it under control, you don't tell me about it, okay? But they're both just nutritional deficiencies. We can get you off those. We can get you off those programs too. So, at 240 pounds, I want you to get one meal a day is going to be a keto caramel meal. They come 10 bars in a box. You're going to need to get 3 boxes a month. So you're going to get 1 meal a day, a keto meal. The other 2 meals, I want you to eat like an Asian. Rice and also sweet potatoes and beans and squash and that kind of stuff, as opposed to wheat, butter, and oats. No wheat, butter, and oats of any kind. Then let's see here. I want you to have it starting out at 200 and 40 pounds, I want you to have 2 healthy brain and heart packs per month, a full dose of everything twice a day, 2 healthy brain and heart packs, a full dose of everything twice a day. I want you, because you have so much joint problem, I want you to get 2 bottles a month of our MSM, so you can take 3 at breakfast, 3 at lunch, 3 at dinner time. And that will support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between vertebrae, bone mixture, bone cell, walls of arteries, skin, and so forth. And then because you have diabetes, I want you to get 2 bottles a month of our sweeties. You can take 3 twice a day. Don't cold turkey off your medication, but as your blood sugar begins to come down, you can slowly reduce your medication based on the numbers. Same way with your high blood pressure. Don't cold turkey off the high blood pressure medication, but I want you to take 2 bottles a month of our Ultimate Daily Classic tablets and take 3 twice a day, and your blood pressure will come down. And as it comes down, you can slowly reduce your medication. And usually within a couple of weeks, both of those are significantly better. And so 2 to 4 weeks, you could be rid of both of them, but certainly within a month or so, you'll be rid of both high blood pressure and diabetes, because they are not genetic, they're not autoimmune, they're just simple nutritional deficiency diseases. Same way with your bone and joint problems, that will all go away, and you'll lose a half a pound to 2 pounds a day by getting rid of the bad foods and getting on the 1 keto meal a day. So give us a call every 2 weeks, because you're going to have a wonderful story, Wanda. Your story is going to help a lot of people, because your picture that you laid out for us is very common in the industrialized world, including the United States. These are all nutritional deficiency diseases, and doctors love them because they can actually manage your symptoms with drugs. Well, why would you want to be on drugs for 40 years for diabetes when you can get rid of it in 2 to 6 weeks? Why would you want to be on high blood pressure medication for the rest of your life when you get rid of it in 2 to 6 weeks? Why would you want to be, 100 pounds, 140 pounds overweight, when you can really, in say 3 months time, get down to your good weight for 5'2"? This is all very easy stuff, but you're going to have to be proactive and start telling your friends, because they're going to say, Wanda, what are you doing? You're looking good. Do you have any gray hair? Do you have any gray hair or white hair?
Yes.
Okay. Do you have any vitiligo in your skin? Any skin color loss?
No.
Okay, good. Do you have any varicose veins in your legs or feet?
No.
Okay, good. Well, keep an eye on your hair, because your hair color will slowly come back. Hair color loss has nothing to do with age. It's not because you're 75. It's because you're missing nutrients, and it's a red warning light when your hair color goes away and you have white, gray, or silver hair. But your hair color will come back because these nutrients are what's missing, and your skin will start making nice, healthy hair of your natural hair color. Okay.
Okay.
You're going to get a lot of compliments. What are you doing, Wanda? You're looking great. Okay, back to
Thank
you.
you.
All right. Thank you so much, Wanda, for coming on with us and letting Doc go over what you've got going on, because there's so many people out there that have bone-on-bone conditions.
Oh, yeah.
Think that, and I think people get so used to taking pharmaceuticals.
Or getting a knee replacement or a
Oh.
hip replacement.
Right. And when we get back from the break, Dr. Wallach, I want to ask you about calcium channel blockers. There's so many people that are getting put on that, having problems with arthritis in their joints and everything across their body. And if you could just share with us if there's a link there, what's going on. But for right now, let's go ahead and take a 5-minute break. And I want everybody to get up and stretch, get those bodily fluids moving, get your glass filled up, and we will be back in about 5 minutes. Now, for those of you who would like to ask a question, please look in the Zoom menu, and you're looking for something that says raise hand. That can be under the reactions area. Click on participants. There's some double dots there. You might be able to find the raise hand there, but we want to make sure that if you have questions, you get answers as well. Now, for those of you who were sent to this program by somebody specific, please get back with the person that shared this program with you. They cared enough about you to make sure that that you're getting information that you're not going to hear anywhere else. So give them the courtesy to get back by getting back with them and say, hey, this Dr. Wallach, he was talking to somebody else. They had exactly what I have going on, and he gave them some recommendations on products. Now, to find out what those recommendations are again, go to our website, askdoclive.com, and you will find all of the replays from all of our Ask Doc Live programs for over a year now. So excited that we have that available to you. Jonty, our webmaster and our technical guru here, does such a fantastic job making sure those get up and posted in a very timely manner. So thank you so much, Jonty. Take a break. Get up. Stop listening to me. I'm going to take a break as well. See you back in just a few. All right. Welcome back, everybody, to Ask Doc Live. Again, my name is Rebecca Kozak, and I am here. And I'm honored to be here to be able to share information with you that you're not going to hear anywhere else. And that's how you can be empowered as an individual and take control of your own health journey. So let's get Dr. Wallach back here with us again. And as soon as his audio reconnects, we will be able to hear more from Dr. Joel Wallach. Dr. Wallach, go ahead and unmute yourself.
There we go.
There we go.
Can you still hear me?
Thank you so much. Yes. Hear
Okay.
you perfectly. So Dr. Wallach, let's go ahead and go to one of the questions that's come in through email. And this is from Damien. Damien says about 2 months ago, he was diagnosed with polymyalgia rheumatica. They put him on some medication that has helped, but he wants some advice in regards to what he can do nutritionally instead of just mask the symptoms. So Damien is 68 years old, a male. He's otherwise in good health, fit, 5'4", 143 pounds. He says, I do have both knees bone on bone for 20 years now from osteo.
Okay. You ready?
I'm ready.
All right. All right. Well, Damien needs to get off all the bad stuff. He needs to get rid of all the bad stuff. No fried foods, no processed meats, no oils, no glutens, no wheat, no butter, oats, no sugar, no carbonated drinks. Either diet one's got to go. And then at 143 pounds, I want him to be a little heavy since he's had bone on bone for so many years. I want him to have 2 of the healthy brain and heart packs per month, a full dose, everything twice a day. I want him to get 2 bottles a month of our MSM so he can take 3 at breakfast, 3 at lunch, 3 at dinner time. And they will support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, discs between vertebrae, bone mixture, bone cell, the skin, walls of arteries and veins, all kinds of stuff. Also, he should get, he needs 2 quarts of our Cal Toddy so he can take an ounce at breakfast, ounce at dinner time. It's got extra calcium in it. It's got vitamin D3 in it, and it's got collagen in it. So he's going to take 1 product instead of 3 by doing that. Okay. Let's see here. And then for pain on his knees and wherever else he's, got pain, neck or wherever, he can use our CM cream and our trauma oil. Put that on. He needs to stir it up every morning because the cream will settle to the bottom. Water comes to the top. People say, well, how did you put it on? Well, I used a Q-tip and I dipped it in there. Well, you're only getting water. If you didn't stir it up, you need to stir it up and make it a uniform sort of mix so that you can get that cream on your skin, on your knees, your hips, your neck, and your elbows wherever you have pain. And usually within 10 minutes, you're going to have some significant pain relief for about 2-3 hours. So that'll help him with the pain stuff.
So
But
yeah,
go ahead.
that CM cream, and I was looking for my little canister because I used to have one here, but I haven't used it in so long. but I would put a couple drops of the trauma oil, I think
Mhm.
it, well, 12 drops in that canister, and I kept that little seal. All I had to do was shake it up before dipping my finger in and
Mhm.
using it when I
Mhm,
needed
mhm.
it.
Well,
And
there you go.
it did give several hours of relief. And sometimes there was days where I used it once and didn't need it for another day or so. So it really does work. Now, Dr. Wallach, I want to mention something that a lot of people think, well, I'm in pretty good health. And then you go into, but I have bone on bone. And stuff like that, it does not have to be part of getting old, right, Dr. Wallach?
Oh, no. So you ever hear growing pains in kids?
Yes.
Yeah, but growing pains in kids is arthritis in their joints. But hundreds of years ago, people knew that arthritis only occurred in older people, so they came up with growing pains to describe these pain in these kids' joints. They had arthritis. Arthritis is not an age thing. Babies can be born with arthritis, and it just has to do with malnutrition of the bones and the joints and the cartilage and tendons and ligaments and muscles and all that kind of stuff. And so, yes, so it's not an age thing, and it's certainly not a genetic thing. It's not an autoimmune thing, and that's why I'm considered one of the two founding fathers of the science of epigenetics, because I did 20,000 autopsies. It was a $25 million grant from NIH, and did 20,000 autopsies on that one project. And there were no genetic diseases. There was no autoimmune diseases. And it freaked them out because they couldn't believe it. I said, well, that's because it's a false theory. There's so many false theories out there, and everything from politics to medicine to manufacturing and so forth, medication. And so don't be too surprised if there isn't some, misinformation and false theories when it comes to health also.
I remember as a kid having horrific growing pains. I mean, absolutely horrific, where my mom or my grandmother would be rubbing my legs trying to help me.
Yeah, well, see, you were already deficient in nutrients when you were a kid.
Well, yeah, I had a lot of stuff going on when I was a kid, but now I know, and my kids will not go through that, or my grandkids.
Well, that's one of the reasons we love you.
Yeah, I'm definitely, I want to shout this from the mountaintops, Dr. Wallach. It has given me my life back. I owe so much gratitude for you and all the work that you have done to make this possible. And, people like, oh, I can't give up gluten. Oh, I can't give up my olive oil. I'm like,
Well, I
well,
do have another company. I sell coffins too.
yeah, I'm not going to be needing one of those.
But these people who say
Won't
silly
happen.
things like that,
Yeah, well, and you choose your hard. You choose your hard. What's going to be hard for you? Growing old with lots of pain and having to take bags of pharmaceuticals to mask up this and then go back and get more and more to correct the damage that's been done to other
and,
parts of
and
your
have a
body because
funeral
of
and have a
chemicals.
funeral when you're 58.
Yeah, it's you choose your hard, and going gluten-free, folks, really is not that hard. Removing oils, bottled oils from your diet, even if you're a baker, is really not that hard.
Now we have a
And
book,
so worth it.
Dr.
And
Wallach's
there
Cooking
is
Without
a
the Bad Foods. Yeah.
yes, I love it. I love it, love it, love it.
300 pages of gluten-free and oil-free cooking.
And that just proves that it's possible, and it's put together by
Three professional chefs. Yeah, 3 professional chefs and myself. We had kind of a wager because they didn't believe it could be done. It was a 3-year project, and it came out so well, it freaked them out. And so we made it into a book.
Yeah, absolutely. And I love that. I love that because I've had a lot of people say, well, is there a cookbook, for the last 5 years? Or is there a cookbook that goes through what Dr. Wallach's good foods, bad foods list? And the answer now is yes. And you can find that at askdoclive.com under Dr. Wallach's publications. So
Yay.
yes, we are excited to be able to offer that. let's go to another question that came in, Dr. Wallach, and it's from Stan. And Stan has a prostate health question. His PSA is about 15 and keeps going up. He is scared. His father also had prostate issues. So for Stan, I didn't get a date, or I didn't get an age or weight. But let's say Stan is 60 years old and 175 pounds at 6 foot even. What
Okay.
would you recommend for somebody with prostate concerns with their PSA being at 15?
Okay, it's not uncommon in middle-aged men to have a prostate issue. Okay, just, like it's not unusual for women who are in that age group that have girly stuff going on, right? Same principle, because these are all nutritional deficiencies. And so what he needs to do is get off all the bad foods, no fried foods, no processed meats, no oils, no glutens, no wheat bran rhinos, no sugar, no carbonated drinks. He also needs 2 healthy brain and heart packs per month, a full dose of everything twice a day. And then I want him to also get our Zera test, take 3 of those twice a day, that'll be 2 bottles a month. And they give their Sertoli cells in the testicles all the raw materials they need to make testosterone. And then he also needs the ProstFX. He could take 3 of those twice a day. It's 2 bottles a month. The reason why I threw in the MSM, because probably I'd say at least 50%, maybe 75% of the time when people complain about prostate problems or urinating too much or they have to catheterize themselves, they can't urinate, and the doctors blame it on the prostate, it's really a back problem. Squeezing the sciatic nerves to control the bladder, and they blame it on the prostate in males. They don't know what to do with a problem like that in females. Okay, and so, but this is that's why I kind of went that direction with the MSM to cover that issue.
All right. And, I've heard so many people say, I roll over in bed and then I have to go pee.
Mm-hmm. Yeah,
Well,
it's a back problem.
And yeah, I mean, that right there just shows that there is a link, and being able to support the body and give the body what it needs to help strengthen that connective tissue, keep those nerves from being pinched, it's simple, Dr. Wallach. It really is.
Yeah. Once you know the answer to the question, it is simple.
But it's making sure people get the answer to those questions.
Yeah,
And
well,
that's
see, you
really-
have to remember, again, the first thing they teach medical students the first day in class is when you cure a patient, you lose a customer.
Well,
That's
we're
the first
looking
thing
to
they
help-
teach them.
Yeah, we're looking to truly help people, Dr. Wallach. And I'm
That's
so
why
glad that
that's
you
why
didn't-
we love you.
Yeah, that I'm so glad that you didn't take that thought of curing is going to eliminate customers to heart, or you're just shouting it what they
Yeah,
can do.
the instructors always say, well, these people, they never do everything right anyway, so you have to manage it for them. And so when we manage things, they're happy. And this, it made me cringe.
Yeah, me too. Me too. Well, let's go to our next hand that is up, Dr. Wallach, and
Okay.
Christy. Christy, go ahead and unmute yourself. And if you're able to turn your camera on, that would be fantastic as well. Welcome back, Christy.
Hi, I'm just doing an update.
Okay.
I originally called. Almost 2 months ago. I'm 71, 107 pounds. Let's see, 5'2". I called for macular cellophane, optic nerve atrophy, and I'm changed my diet, taking everything that you said. My eye problem is still with me, and my tinnitus is still the same, but my sciatica is much, much better. The leg cramps that I had at night and first thing in the morning are virtually gone. I can stretch in the morning without being in excruciating leg pain.
It's a beautiful thing.
And my age spots are still disappearing.
Are you getting any hair color coming back?
No, I haven't noticed any changes on that. The only gray I usually have is right by my left ear. But But
Okay.
that'll come, I'm sure, but I'm
Okay,
still
for-
worried. I'm still worried about my optic nerve atrophy, but I'm
Well,
hoping that'll,
the ONA and the tinnitus are both due to osteoporosis of the skull. Okay.
yeah,
And so what I want you to do is just double check, make sure there's no gluten in the house. I mean, just, you can't even say the word, okay? No gluten in
Yeah.
the house, no wheat, bran,
No,
rye,
I
or
th-
oats.
everything got thrown out 2 months
Okay.
ago.
Well, you should have given it to a doctor.
Well, I don't go to doctors. And the
Well,
only
just-
only reason that I went to a doctor was because my right eye,
Yeah.
you can't see out of the
but,
center part.
yeah, but you're not getting my message. You should have given the gluten to the doctor.
Well,
Okay, instead of throwing it out. Okay, so
Well-
anyway, so to deal with the osteoporosis of the skull, I want you to, if you're not doing it already, I want you to add the Cal Toddy to your program, and 102 pounds, 107 pounds, whatever it is, you could
Yeah.
take 1 ounce a day, take a half ounce of breakfast, half ounce at dinner time. It's going to give you more calcium, going to give you more vitamin D3 and more collagen. But I also want you to make sure you're getting that MSM. You take
got that.
okay, 1 bottle a month. Take 3 of those twice a day, or 2 or 3 times a day.
Yep.
And if you want to, you can also add the Pro Joint FX. It has a whole bunch of other stuff in it too. You could take 2 of those of your body weight. You could 1 bottle a month of Pro Joint FX. Take 2 of those twice a day. And it'll also help rebuild the skull and take the pressure off that optic nerve and the
Okay.
auditory branch of the cranial nerve. Okay.
Yeah.
But the fact that
Okay.
you have seen benefit in other places, just keep going and add those other things to it, and then call us in, say, 2 more weeks.
Yeah. Okay. Sounds good.
Okay, Christy, thank you.
Thank you.
Awesome, Christy. Everything's not going to go away overnight, Dr. Wallach. We didn't get this way overnight. So, for some of us, it's taken 45, 50, 60, 90 years to get where we're at.
So yeah, give us 90 years, give us 90 days to get better.
Yeah, 90 days is definitely going to make a huge difference. It may not take care of everything, but you'll be on the right track, and you'll be getting the digestive system put in the spot where it can actually utilize the nutrients that you're taking so that your body benefits the most. So let's go to the next question, Dr. Wallach. I have so many that come in, so I'm glad we're able to get to these. Zuki is wanting to know about mental health issues and what vitamins and minerals can somebody take when they are experiencing issues like bipolar and schizophrenia. So let's look at it, just somebody 45 years old, 145 pounds, or even just go based on 100 pounds, Dr. Wallach. What would you recommend for somebody that has mental issues that include bipolar and schizophrenia?
Okay, very common, because the brain needs 90 essential nutrients. 75% of the brain weight is cholesterol. Nobody should be taking statin drugs to lower cholesterol. Everybody needs to eat 3 eggs twice a day per 100 pounds of body weight with soft yolks, not fried, not hard boiled. Soft poached, soft yolks, soft boiled, soft yolks, soft scrambled butter. I had 3 soft yolked eggs this morning for breakfast, along with some of my Alaska smoked salmon. I had 3 big scoops of wild rice steamed. I had 2 of these 4-ounce cups of gluten-free and sugar-free yogurt. And then I had all of my supplements. That was my breakfast. I apologize. I did have a banana also. Had a piece of fruit, had a banana. Okay. And so I've been doing this for a long time. And so this is not difficult. And the brain responds very quickly. So none of the bad foods, 3 eggs twice a day with soft yolks to increase the cholesterol in the brain. And then at 145 pounds, again, I would go with 2 healthy brain and heart packs per month, 2 healthy brain and heart packs per month, a full dose of everything twice a day. I would also get, in case there's osteoporosis of the skull involved, even at 35 years old, I would take 2 bottles a month of the MSM, so they could take 3 at breakfast, 3 at lunch, 3 at dinner time. That's going to support and promote maintenance repair, cartilage, ligaments, tendons, connective tissue, discs between vertebrae, bone makes bone itself. Then I want them to take 3 of the Ultimate Daily Classic tablets, 3 at breakfast, 3 at lunch, 3 at dinner time. That'll be 3 bottles a month. And they're designed to support and promote healthy blood flow through blocked arteries everywhere in the body, including the brain, the coronary arteries, and the kidneys. Because you can have, I think there's like 12 different diseases you get to have memory problems. You could have memory problems in your brain because you don't have enough oxygen. You have vascular dementia, they call it, okay? Vascular dementia because the arteries in your brain are plugged up. And doctors, oh, we're going to do a coronary bypass. Well, what about the brain? Okay, so we have to deal with the brain also. And so that's why I want the Ultimate Daily Classic tablets. Then we also have the Synaptive. Take 3 of those twice a day. It's 2 bottles a month. And the Synaptive are the raw materials for your brain to take and make the biochemistry necessary for one cell to talk to its neighboring cells in the brain. Then you also need the D-stress, capital D, like David dash stress. Take 3 of those twice a day, 2 bottles a month. And then the Ultimate Niacin Plus. Go ahead and take 1 of those twice a day as 1 bottle a month. And I would also, one last thing, I would go with the Fucoid Z. Take 3 of those capsules twice a day. That's 2 bottles a month. And let's go there. Again, none of the bad foods, and I'll do all this. And it's worth saving your brain and not having to go to a mental house and stay there and be locked up and given drugs and all that kind of stuff.
Absolutely. And I would just like to throw in depression. There's so many people that are going through depression, whether it's chemical depression or situational depression right now with the way things are.
Oh, yeah.
That this would be ideal for somebody that's dealing with depression as well.
And they're not they're not eating right. When people get depressed and they're not feeling right, they eat wrong. They do everything wrong diet-wise. And so they do have to clean up their diet and get rid of the bad stuff.
Yeah, absolutely. And it's a matter of how bad do you want to feel better? It's real easy to clean up and remove things from your diet when you really do want to feel better. Now, Dr. Wallach, I have a question, and this is going to your vet hat. Okay. So Dixie is asking about her chicken with bumblefoot. What would you recommend? And I know there's a lot of people that are starting to raise their own food and they do their own eggs, so they're getting more and more backyard chickens. What would you recommend for bumblefoot?
Okay, well, bumblefoot is kind of like when people get plantar fasciitis, they're in the bottom of their foot. It's a very similar type of thing. And so here's a case where you want to put out a flat container of some kind, maybe 1 inch deep, and depending on how many chickens you got, but I would fill it with our Arthrodex, our granular minerals. I'd go that direction. Also be sure that you're feeding those chickens a good egg laying mash you can get from a farm store for chickens that have vitamins and minerals in it. They're alfalfa pellets, and just don't get them corn and throw them corn. Okay, you got to give them those pellets with all the vitamins and minerals in it for egg laying. I'd go for the egg laying because there's a lot more minerals in egg laying food for chickens than just a standard food. So I'd go that direction, and then I'd put out a dish of the Arthrodex, and so they can peck through it and get a few of those minerals too.
Absolutely. Thank you so much, Dr. Wallach. Now the next question is coming from Jim, and it's in regards to eating potatoes. With potatoes being so starchy, is it like eating sugar?
Not if you're taking all your supplements properly, so that the potatoes are turned into carbon compounds for fuel burning. And the carbon in potatoes do not quite act like sugar, for instance, in juice. Okay, when you're drinking juice, like orange juice, grape juice, apple juice, you're getting a lot of sugar. Oh, the kids just love it. Well, yeah. But you're causing a lot of problems for them, their ability to think properly. They get reactive hypoglycemia, they go to sleep at class, all this kind of stuff. And so there's a big difference between eating a potato and you have all your dietary faculties going right and so forth, and all the right production of enzymes and stomach acid and so forth. You're not going to have a problem by eating potatoes, but except no fried potatoes. I have maybe 2 to 3 mornings a week. I will have baked sweet potatoes. If I don't have them for morning, I will have at night with butter on them. And we have our pink Himalayan salt from our Savor division, which I put on. I like the pink Himalayan salt with the round black pepper in it. And that goes on the sweet potatoes, especially when I have lamb chops. Woo, what a combination. I love that. And so you don't have to give up good food. You just can't have table sugar. Okay. And even some people, they'll react badly to even honey. And so I'd wait until you're on a good nutritional program, a good diet for say 6 months before you even start using a drop or 2 of honey. Don't use 3 tablespoons of honey. You can have a drop or 2 of honey just for taste, as opposed to, trying to make that your main meal.
Got it. All right, thank you so much. Because I get a lot of people, that ask questions about potatoes, and potatoes and yams are two different things as well, right, Dr. Wallach? Where you're getting more actual vitamins in a yam.
You're getting,
if I understand that.
you're getting beta carotene in the yams, which is kind of vitamin A, and you're getting a lot of fiber in there. And the nutrition, other than calories in potatoes, whether it's a yam or a white potato, Irish potato we used to call them, is where they're grown and what they're fertilized with. They may only have 3 nutrients in them because that's all they're getting. But so in our garden, we use the Bloomin' Minerals, which has 78 minerals in it. And so our tomatoes and cucumbers and celery and that kind of stuff, we don't grow potatoes because the squirrels love them too much out here in California. They eat them before we get them. And so we grow cucumbers and bell peppers and onions and tomatoes. I think I got them all.
All right. Well, thank you so much, Dr. Wallach, for sharing that. I know, people have a lot of questions about food because they hear so many different things.
Well, again, they want to get that book, Dr. Wallach's Cooking Without the Bad Foods. And it goes into a lot of that sort of stuff.
Awesome. Now, let's go to an email from Bill. And Dr. Wallach, for about 6 years now, Bill has been dealing with an unbearable itch. It's concentrated in certain parts of the body, and it feels like it's underneath the skin, but there's no rash. It started in the groin area, and it's been there on and off for a few years. And over the past few years, it'll move to his belly for a few weeks, and his chest, his armpits, with very, very little temporary relief. Now, he says that he's done lots of blood work, and they're not getting any closer to what might be causing that, Dr. Wallach.
Okay. Do we have to guess at his weight?
Yep. Let's guess at the weight, and let's give him 55 for an age.
Okay, 55. Let's say you can't go wrong with 160 pounds. Okay. 55 years old. Okay. Because he said he's had this itch for many years.
Yes.
All right. Now, this can be caused by a deficiency of collagen. And so, I'd like to know if he's shrunk any. Does he have osteoporosis of the skull? Is he shrunk and his vertebrae are smashing his nerves that, go to his skin and his chest and his belly and his groin and all that kind of stuff? Again, it's a back thing maybe causing all this because he's got a gluten problem and he's eating gluten and not supplementing. So none of the bad foods, no fried foods, no processed meats, no oils, no glutens, no wheat, butter, oats, no sugar, no carbonated drinks. Even the diet one's got to go. And then I want him to have 2 healthy brain and heart packs a month, 2 healthy brain and heart packs a month, a full dose of everything twice a day. I want him also to have 2 bottles a month of our MSM, so he can take 3 of those with breakfast, lunch, and dinner. And they will support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, including the skin and arteries and veins. disc between the vertebrae and so forth. I also want him to have 2 bottles a month of our hair, skin, and nails. You can take 3 of those twice a day. And that's going to help enormously for the skin. But I suspect that he's got something going on. He may have osteoporosis of the skull. And so because this is up and down his whole body, the skull could be squeezing the spinal cord as it's coming out of the back of the skull. Because people forget that your spinal cord is formed in your brain, comes out of the back of the skull. When you have osteoporosis of the skull fills up all the tunnels, including the one that the spinal cord goes through, and is squeezing the spinal cord. And he's getting all these sort of peripheral neuropathies, I would call them. You can get pain, you can get itching, you get swelling. You get them all or get one or the other. So I think he's got osteoporosis of the skull squeezing his spinal cord. That's why he's got all these itches up and down his body. I would like to know if he has white, rare, silver hair. I'd like to know if he has irritable bowel syndrome, those kinds of things. But I'd like to know if he had appendicitis when he was, a teenager, a young person, because appendicitis is drop dead due to gluten problems, irritable bowel syndrome, IBS in the appendix. So at any rate,
that can
go ahead.
also be called referred pain.
Yeah, well, yeah, peripheral neuropathies is called referred pain, peripheral neuropathies. Because he's getting this, what's really going on is in his back, but he's feeling the pain or itching in his skin somewhere else. If it's in the back and he's feeling it in his groin, getting his back, he's feeling it in his belly. And those are called either referred pain or
Or the peripheral neuropathy. So
yeah,
it's,
or peripheral, thank you, peripheral neuropathies.
Yeah. All right. Thank you so much, Dr. Wallach.
Yeah, it depends on what college they went to.
There we go. Okay, so the next question is coming from Carol, and it's a general question wanting to know how much magnesium is needed for daily intake.
I'd have to look at the papers to be correct, because if you get too much, you get diarrhea. Okay. But if you look, you can just ask Siri, what's the daily minimum requirement for magnesium for a 100-pound person? And Siri will tell you.
Now, we have to remember, though, Dr. Wallach, that, when Siri answers, it's going to be recommended daily allowance that is put together by an entity that is wanting you to survive, but not necessarily thrive.
Well, that's correct. And of course, they don't tell you to stay away from the bad food so you can absorb it. I mean, there's all kinds of stuff going around there, but at least that would give them a number that's based on research and so forth. But this is where Rare Earths and Cures is a very valuable book, because if there's any question, if they're supplementing and they think they have a magnesium deficiency or excess, they need to get a hair analysis, and they'll tell them all the nutritional minerals, one chart, where they're at. Are they all in the middle where they should be? Are some too high, some too low? Are they all low, meaning you're not absorbing because you're eating too much gluten? And then, that'll give you a very, very personal, there you go. That'll give you a very personal, chapter 10 tells you how to collect the hair, how to box it up, where to ship it. And don't forget the check, because they won't run the test without the check. I have people say, well, I've been waiting for months. I call them, they say, well, they never sent a check. So he's just sitting here on the hair waiting for the check. And so they won't run the test without the check.
Right. And also in that, Dr. Wallach, is the interpretation of the hair analysis. So it goes.
It goes into that, yes, but some of that I don't agree with, but it's to what they recommend and so forth. So you still need to ask me when you get the numbers and so on. But it doesn't hurt. Also, you'll get a second chart in addition to the one that gives you all the nutritional minerals. There's a second chart that gives you what's going on with the toxic metals, lead and mercury and uranium and all these other weird minerals and things that cause problems. Because I get so many people, Rebecca, who were in the military. They say, "Oh yeah, I was in the military for 20 years, and I know I was exposed to all these toxic chemicals. Did you ever do a hair analysis? No. Okay, well, let's do a hair analysis. I get a hair analysis on them, 0. So you have other problems. You have nutritional deficiencies. All your complaints are due to nutritional deficiencies, not from toxic metals, because you don't have any toxic metals according to this test. And it's your hair, so it should be correct for you.
Yeah, yeah, and tell us the difference in the benefits of doing hair analysis over just depending on blood work for nutritional composition.
Oh, okay. Well, blood test, for instance, you can have high blood calcium and be calcium starved because your parathyroid glands are pulling calcium out of your bones to try and make your body happy and getting enough calcium to it. And oftentimes the parathyroid glands will overcompensate and you get too much calcium floating around your blood. The doctor says, oh my God, look at this test. Stay away from calcium. Don't even say the word. You got too much calcium. And you're starving for calcium, but he says, don't take it. And I get this, not a lot, but maybe 10, 12 times a year from the hair analyses. Because we do hundreds of hair analyses a month. And so 10 or 12 times a year, people send a picture and say, look at this, the calcium's off the roof here. My doctor says stay away from calcium. Well, you need to change your doctor because he's an idiot, okay? Because it has nothing to do with too much calcium. It's a starvation of calcium. Your parathyroid glands are overreacting to that, pulling too much calcium out of your bones to try and maintain calcium, and that's why it's too high.
Now, that might lead into my question before the break, Dr. Wallach, with the calcium channel blockers.
Mm-hmm.
Can you go into a little more on that and how that is either benefiting or not benefiting us?
Well, it depends on why the doctors are giving them calcium channel blockers. If they have, for instance, if they have chest pain, if they have tingling, if they have that sort of stuff, I'm really not a big fan of calcium channel blockers. I would rather really know what's going on and do the perfect thing as opposed to that. That's a guess, and they don't know what to do, so they're going to give you something and hope it works.
Right. Well, and
Hair
so I know
analysis.
that go ahead.
Hair analysis.
Right. Absolutely. Well, and for those of you that don't know exactly where to start, let's start with the foundation. The 90 essential nutrients. You hear Dr. Wallach mention the brain and heart pack. That's going to support the body as a whole at the foundation. If you're not able to start anywhere else, I recommend you get with the person that shared this program with you and say, hey, I want to get on the brain and heart pack. Give us 90 days. For the most part, your body is continually regenerating cells. And when you give the nutrition that's needed for those cells to be healthier and healthier, there's no other way for the body to respond. And that's become healthier and healthier. Right, Dr. Wallach?
You got it, girl.
Yeah, I love getting emails, from folks. And here's one that says, just wanted to give some feedback. I have been on the 90 essential nutrients now for 6 months, and I have been able to get rid of all of my he says, I'm trying to
Prescription
phrase this,
medication.
okay, so he listed all of them out. He no longer has to take those, and it's because the doctor took him off of them. He no longer needed them. So we don't want you to quit cold turkey whenever you're on a handful of pharmaceuticals. We do want you to be able to support your body so the body can do what it was designed to do by the Creator in the beginning. Next question, Dr. Wallach, has to do with stage 3 kidney disease. Leon has been dealing with stage 3 kidney disease for 2 years now. He's 63 years old, 144 pounds at 5'8". So he's very trim for a man, but he's dealing with some kidney issues, Dr. Wallach. What would you recommend for?
Okay, he didn't say that he was on dialysis or had high blood pressure or anything like that?
No, he does not mention anything like that. But most of the time, from my experience, if they've got some kidney issues going on, blood pressure is right there with it.
Exactly, because the kidney will release a hormone called renin, drives the blood pressure up to get more blood into the kidney, and that's why the blood pressure is there. Okay, so Needs to get rid of all the bad foods, no fried foods, no processed meats, no oils, no gluten, no wheat, bran, rhinos, no sugar, no carbonated drinks. And then at 144 pounds with stage, what'd you say, stage 3 kidney disease, I'd have him take 2 healthy brain and heart packs per month, the full dose, everything twice a day. And then I would also have him take 3 bottles a month of our Ultimate Daily Classic tablets. So he can take 3 at breakfast, 3 at lunch, 3 at dinner time. And they will support healthy blood pressure and healthy blood flow into the kidneys, the coronary arteries, the brain arteries. And it makes a huge, huge difference. We get so many people who are not urinating. They're on dialysis 6 days a week. And a couple of weeks they're urinating. They drop them down to 3 days a week of dialysis. And after 2-4 more weeks, they're totally off of dialysis and going back to a normal life. But they do have to stay on the 90 essential nutrients.
Now, I know with some people with kidney disease, they have blood sugar issues and others don't. So if there's a blood sugar issue, what would you recommend?
Well, if there's a blood sugar issue, they need to throw in the sweeties. Okay. I know there's almost always a blood pressure issue. That's why I said the Ultimate Daily Classic tablets. But if they do,
Sugar.
yeah, but if they have blood sugar problems, they have diabetes or pre-diabetes or reactive hypoglycemia, something like that, per 100 pounds of body weight, I'd have them take 2 bottles a month of the sweeties. They take 3 twice a day. And if they're on medication for their blood sugar issues, take their blood sugar as they're supposed to. And as the blood sugar begins to come down, they can slowly reduce the amount of medication based on the numbers. And usually it takes, like 4 to 6 weeks to get off the medication.
All right. Thank you so much for that. And for everybody that's here with us live, if you have a question for Dr. Wallach, don't be shy. Raise your hand. You can find the raise hand option in the Zoom menus. We have a few more minutes here to take another question, but hey, I've got lots of questions that get emailed in. So we're going to go ahead and just continue with those. But I have Dave who has asked a question in the chat. And female, 69 years old, 5
60. Wait a minute. Did you say 60 million years old?
69 years old.
Oh, okay. Female.
Female.
5
foot 2 inches, 150 pounds.
Okay.
Severe ulcerative colitis.
Oh, ulcerative colitis, irritable bowel syndrome, celiac disease, Crohn's disease, diverticulitis. All these are caused by gluten issues. Doctors might say, oh, you have lupus or you have an autoimmune disease, your body's attacking itself. No, everything from appendicitis to all these colon problems and small intestinal problems are due to gluten. And so what is her name?
So Dave is writing in regards to a
Oh, Dave.
friend.
Okay. David, because I said Dave, female. Okay. So he's writing in for a female friend. So 130 pounds, you said?
150 pounds.
150 pounds. Okay. She needs to get rid of all the bad foods, no fried foods, no processed meats, no oils, no gluten, no wheat, no bran, rhinos, no sugar, no carbonated drinks. And then let's see here. I would have her take the 2 healthy brain and heart packs per month, the full dose, everything twice a day. I would also have her take the Ultimate Daily Classic tablets, 3 of those twice a day. It's 2 bottles a month. And so we don't know about high blood pressure or diabetes.
It does not say.
Okay. Yeah. And so, yeah, I'd go with the Ultimate Daily Classic tablets, 3 of those twice a day, the MSM, 3 of those twice a day, 1 bottle a month. And I think that's going to cover all the issues.
All right. Thank you, Dr. Wallach. So Dave, I hope you got that. Next, let's go to Tasha, who has her hand up. Tasha, go ahead and unmute yourself. And if you can turn your camera on, that would be fantastic as well. I just sent a request to unmute. And you are on live with Dr. Wallach, Tasha.
Hi.
Hi. Okay, let's go. How can we help you?
I have lupus.
Okay, how does it manifest itself? You have rosacea on your face?
I have joint problems, and a little bit of skin problem, but it's mostly the joints.
Okay. How old are you and what do you weigh?
I'm 49 and I weigh 125 pounds.
Okay. Well, lupus is not an autoimmune disease like doctors want you to believe. Okay, so you can get rid of it. You can get rid of it in give us 90 days. You'll be rid of it. Absolutely none of the bad foods. No fried foods. No. I'm hearing a lot of gurgling and talking and
I
background
just turned
noise.
it off, Dr. Wallach.
Thank you. Thank you. Okay. So you need to get rid of all the bad stuff. No fried foods, no processed meats, no oils, no gluten, no wheat bran rhinos, no sugar. Need to let's see here. Take 2 healthy brain and heart. Well, no, you only weigh 125, so go with 1 healthy brain and heart pack per month. An extra bottle of our selenium, so you can take 3 of those twice a day. It'll be 1 bottle of our selenium with the 5 cofactors in the healthy brain and heart pack. So once you take 3 of this, our selenium, not from Walgreens, but our selenium with the cofactors, needs 3 twice a day. I also want you to have the MSM, get 2 bottles a month of the MSM, so you can take 3 at breakfast, 3 at lunch, 3 at dinner time. Take 3, like I said, breakfast, lunch, and dinner, and they will support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, including the walls of the colon and small intestine and so forth, and the skin. And then I also want you to have our hair, skin, and nails. Take 3 of those twice a day, 2 bottles a month. That'll help again with the skin. I also want you to have our ultimate enzymes. You can go ahead and take 2 of those, say 5 minutes to 10 minutes for each meal, with a couple ounces of water. But getting rid of gluten, I mean, there are no such things as gluten-free oats, no wheat, butter, rye, or oats. Can't even say the word. Do not go to spaghetti factories. Say, well, I only just eat a salad. Well, the gal who's delivering that salad to you has just dropped off 10 loaves of bread at 10 tables, and she is covered in gluten flour. And so you can't go to those kinds of places. And so you must avoid those things. If you want to drink beer, it's got to be made rice beer from Australia, New Zealand, or some Asian country. You can have wine, because wine, of course, is made from grapes, and so on. And so you can have gluten-free pizza. You just have to pay attention to those kind of things. But lupus is very easy to get rid of very quickly. If I didn't say it, you need the hair, skin, and nails for the skin. And I would throw that in, just get yourself, I'd go ahead and get 2 bottles a month, so you can take 3 twice a day. And then call us every couple of weeks, because your lupus is going to go away very rapidly if you're very, very, very diligent about staying away from gluten and taking the supplements. Okay.
All right. Thank you so much, Tasha, for coming on and asking your question. Thank you, Dr. Wallach. I know we had touched a little bit on lupus, but when we have somebody that actually has a question and dealing with a condition,
Oh, yeah.
I think it makes it a little more personal, because we can then relate more to the individual. Now, I have a question coming in regards to, from Shane, actually, in regards to his wife wanting to know about fibromyalgia. She's been dealing with it for many years, and his question is, do you have anyone that has realized good results from supplementation? And that's one condition, Dr. Wallach, that I was very much connected to. Not that I wanted to be. I mean, you couldn't touch me. My whole body hurt from this outside of the skin all the way down into the bones. And using your protocol, Dr. Wallach, I was able to get rid of all signs of that condition that affects the muscles, the connective tissue. I mean, the whole body. But it's
and bones
simple.
and the joints, and yep.
It was very simple. I mean, so what would you recommend, Dr. Wallach, for somebody that's dealing with fibromyalgia?
Okay, do we have a weight, or are we just going to go by 100 pounds?
Let's go by 100 pounds.
Okay. All right, per 100 pounds of body weight, she needs to get rid of all the bad foods. No fried foods, no processed meats, no oils, no gluten, no wheat, bran, rye, and oats. You've already said you're the one that had fibromyalgia, and you got rid of it by doing what I said. So that's answered that part of the question. Thank you. And then this one we deal with literally thousands of times a month, because we deal in 60 countries, and people all over the world get this, simple nutritional deficiencies. And per 100 pounds of body weight, 1 healthy brain and heart pack per month. MSM, 3 twice a day per 100 pounds of body weight to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone, makes your bone cell. And then also I'd go with the Cal Toddy. Again, an ounce per 100 pounds of body weight. There's a half ounce of breakfast, half ounce of dinner. It has extra calcium, vitamin D3, and also collagen. I would also go with our collagen peptides. It's a powder. Take a couple of scoops of that collagen peptides powder and throw that in some applesauce or something like that in the middle of the day. If they prefer capsules, they can use our Pro Joint FX, which has these things in there. Okay, could take 3 of those twice a day, and that the fibromyalgia goes away very quickly. And of course, what do you do for pain? You know the answer to that.
CM cream and trauma oil.
Well, there you go. CM cream and trauma oil. It'll get rid of pain for a couple of hours and sometimes for 24 or 48 hours. But after a couple of weeks, your fibromyalgia is gone. So you won't need the topical pain reliever anymore. But if you're really, really in discomfort and disabled by the pain and reduction in the range of motion because of all the inflammation and everything, you should be able to use the CM cream and the trauma oil to relieve that inflammation and pain. And you'll be glad you did.
Yeah, absolutely. I'm ecstatic. So glad. So much to be thankful for, Dr. Wallach, and the fact that I'm here hosting you a few years later and being able to share this information with others is just
and not only did you get rid of fibromyalgia, you lost over 100 pounds.
Yep, lost 100 pounds, a bag full of pharmaceuticals, 17 different medical terms.
Wow.
You don't have to live with it, folks. It's not all part of getting old. It does not have to be, because, we're empowered individuals and we can take control. Well, Dr. Wallach, we're coming up to the top of the hour, and I just want to thank you again. I know that you've got a busy schedule, but you take this 2 hours with us every Friday, and we just so appreciate you.
Well, you and your team are family. We're a family, you and your team.
We absolutely are family. I love this community that Longevity has put together. We're not even, well, Jonty and I are on the same team, but as far as a network marketing company, it's not every man for themselves. We all work together as a community.
That's correct.
Building each other up and providing the resources needed to help individuals, help families. I mean, you just did a big conference, online Zoom, for Crisis in the Church. I mean,
oh yes, that went all around the world.
Fantastic.
And of course, yeah, we had something like 100,000 Facebook people on there.
Yeah,
it was like
I know
crazy.
The Facebook Live was being watched, the Zoom was being watched, the replay is going to be watched over and over. And think about it, folks. Who do you know that's suffering? Have you ever thought of joining us with Longevity, being part of our family and part of a solution to a hurting world? We invite you to get back with the person that invited you to watch this program and say, hey, I want to be part of this community, because we are a community. It is not like some companies have been in history that have made direct sales and network marketing a bad name. We go beyond that because we really, truly do care about everybody. And Dr. Wallach, you've set that example. You haven't kept this in the United States. You haven't kept this from, I mean, you just tell everybody, you travel. I mean, up until the pandemic, you were traveling over 300 days a year.
That's correct.
To make sure people got this information.
Well, we haven't stopped. Now I just do it by Zoom. So I appreciate you guys setting this up.
We save you travel time. How's that? And if nobody has referred you to this program, then go to ask.live.com, click the contact us, and request information about the business opportunity. For those of you who have never ordered in any of the longevity products in the past, and you would like to chat with somebody about what you might need, again, you can go to that contact us at the ASDOC Live website, but we also have a call team standing by at 855-949-7234. Again, this is for somebody that has never tried any of the longevity products and you have not spoken with anybody or referred to this program by anybody. We want to make sure that you get the information and the nutrition you need as an empowered individual to be able to have brighter tomorrows. We want to be a light of hope. And all of us that are here, part of this program, Dr. Wallach, of course, Nasima Omar, Ruth Ellen Sanchez, John T. McCollier, and myself, Rebecca Dukes-Kozak, we care about you. And we want to make sure that you know how much we care. So please get with the person that invited you to this program. Join us every Friday, same time, same place, and also share our replays with individuals. That's what we're doing this for, is to make sure you have a resource that you can share with others, because you don't have to know all about the supplements. Dr. Wallach's got that. We just give you the information where people can ask questions, relate to the questions that are being asked, and make sure that supplementation is being put into the body and taking away those toxic inflammatory foods. That is so important. You cannot out supplement a bad diet. Well, on behalf of all of us, again, thank you, everybody. Thank you, Dr. Wallach. And we will see you next time. Bye for now.
God bless. God bless. Bye-bye.
God bless you.